bone. Unlike conventional understanding, as knees side and the joint pain, and the shock was that are called sky or meniscus, and the self also allows for tennis, football, basketball, because these are pivotal injuries and they can actually cause damage to one or multiple organs within the knee joint. The commonest issues that are relevant in the context of the knee joints is the disease that's called arthritis. Arthritis basically means that the joints wear out, and what that means is that the layer of cartilage that covers the bone gradually gets eroded. The common myth is that arthritis predominantly involves or affects patients who are elderly, patients who are over the age of 55 and 60. This is actually incorrect. There are different types of arthritis, and broadly they can be subdivided into two groups. The inflammatory arthritis, that is called rheumatoid arthritis. In the Hindi language, this is called gathia. This can affect children as young as 8 months to 12 months. This is called the juvenile rheumatoid arthritis, and this can affect joints across the spectrum of age diseases. This is at variance with the other common broad group of arthritis that is called osteoarthritis, that affects patients in the age group of 40 to 80. Um, in arthritis, the patient starts to complain of pain, stiffness, swelling. Night pains are common, and if left untreated or uncorrected, these will usually progress to a stage where the knees start to get deformed. They can bend either to the inside or the outside, or they can get bent in the frontal plane, which means that the patients are not able to fully straighten out the knee joints. And at that stage, uh, usually the treatment is to undergo some sort of corrective remedial measures. I want to reiterate that the treatment of 85 to 90% of all arthritic patients is conservative, which means they are medicines, exercises, physiotherapy, injections, yoga, and leading a healthy lifestyle. Most of these patients will do very well with these non-operative measures, and it's only about 10 to 15% of all patients who suffer from arthritis that will need to come to a stage of either some sort of a surgical procedure, which may be in the form of keyhole surgery that is called arthroscopy, or realignment surgery, which is a partial knee replacement, or where we divide the bone to correct the deformity, or finally the stage of the total knee replacement, which is the end stage arthritis management. And this is today a very efficacious method of treating these difficult problems. And the good thing is now patients are living almost about 25 years after their index surgery with an excellent quality of life elevation. At the end of 25 years, or should the knee start to wear out or loosen, these procedures can be repeated and can be done again. Um, in terms of how you avoid uh, diseases of degenerative origin, the three things that are most common in the population is obesity, is thyroid disorders, and diabetes. All three of these affect the joints adversely. So individual should make an attempt to take care of their weight. And there are various ways to do it, and this may not be the right forum for me to discuss that. Thyroid disorders are a rampant medical condition that affect a large segment of the population. People who have thyroid disorders should make sure that they consult with the appropriate endocrinologist and take the right treatment to make sure that the thyroid values are kept in check, because thyroid disorders uh, adversely affect joints in a major way. We all know that India is the diabetes capital of the world, and it includes almost about 56% of the population. And this is a huge number. Uncontrolled diabetes is again one of the factors that seem to adversely affect the progression of the degenerative process. I've been fortunate enough to have been involved in the field of orthopedics and knee joints for almost about 35 years now. We started off with knee joint replacement and way back in April 1987, where we did the first what we call a bilateral, which means doing both knee joint replacements at the same sitting. And we've done several thousands after that. Um, what has been an interesting journey is the evolution, both in terms of the technique, the options. Various technologies have come, some have stayed, and a lot of them have gone. It is important to understand that we recognize and understand the biomechanics and the kinematics of the knee joint a lot better than we did earlier. And I've been particularly fortunate in being able to be a part of a group that developed and evolved a new knee system with one of the multinational surgical companies. This implant is now widely used, and over 150,000 of these implants have been implanted across the world since it was launched in 2013. In terms of sports injuries, again, we've been fortunate that we were at the cutting edge and among the earliest users of modern technology for management of sports injuries. This is a technique called arthroscopy, which is a keyhole surgery wherein a telescope is introduced into the knee joint. We are able to look inside the knee, and virtually every possible injury can be managed arthroscopically, whether it is removal of pieces of bone, removal or repair of the cartilage and meniscus, which are the shock absorbers, reconstruction of one or multiple ligaments. We are also able to fix fractures now using this technique. What that does to the average patient is, because you're not opening the knee joint, the rehabilitation, the recovery process is increasingly hastened, and a lot of these patients are able to recover very, very quickly and are able to go back to their competitive level of sports. We have, to our credit, performed surgical procedures for a number of international sports people. A lot of them have gone on to achieve laurels for the country. They have achieved world championships, medals. Gopi Chand, who won the All England badminton championship. We operated in Bhaichand Bhutia, Karnal Maleshwari, various wrestlers, a lot of the cricket players. And with this technology of arthroscopy, which is now almost the buzzword for management of sports injuries, we have been able to bring a lot of these athletes back to their feet. Um, there have been other technologies that have come into the realm of knee surgery. We have computer navigation, which was very, very popular in the early 2000s. Now there are various other technologies that have been introduced in the form of robotics, which we have also embraced. And of late, we've been doing a lot of our surgeries using the robotic technology. What that does is that we are able to approximate our dimensions and our accuracy down to almost about zero point 0.1 millimeter, and we're able to deliver to the patient the exact kind of alignment that is required to make sure that their knees and hips function as per their norms. So this has been the latest and the most relevant advent in terms of the recovery process of the patients who undergo these surgical procedures. I would yet again reiterate that surgery is an adjunct, it's an additive option and is not required in the vast majority of cases of arthritis or sports injuries. A lot of these can actually be treated very, very adequately with physical therapy and rehabilitation. Which brings me to the topic of rehab and exercises. Any knee injury is almost synonymous with the need for physiotherapy. So, sports medicine has today developed into an art form, and it's a super specialty in its own right. And today, there are a lot of physical therapists who are trained in management of sports injuries, particularly with relevance to shoulders or hips or backs, and particularly with hands, wrist, and most importantly with the knee joint. And there are several examples of these within the ambit of the Indian sports personalities who have undergone injuries, surgeries, and subsequently had very efficient rehabilitation. So, sports injuries rehabilitation is relatively a new concept in the Indian armamentarium, but I'm glad to say that today we have centers of excellence all over the country, and our physical therapy department has been in the forefront of managing these sports injuries for a number of years. We still operate and treat a large number of national and international level sports people, and we are very happy to say that a large percentage of these have gone back to their index sport. In terms of the what I would like to finally wrap up this conversation is to address the concept of healthy living, healthy eating, taking care of your bone health, bone age. The common myth is that calcium is mandatory for every single individual. It's not. A healthy living, healthy eating habits, having the right amounts of protein, having the right amounts of diet supplements in the form of proteins, whether it is veg or non-veg, and both provide ample ingredients for both. Calcium by itself, I must add, is a very difficult salt to absorb. Vitamin D supplements are required, particularly in the context of the modern day civilization, the way we live, where we stay indoors most of the time, usually well covered up. So our exposure to sunlight is really quite at a premium. And vitamin D levels are very labile, which means that most of us, when we get our vitamin D levels, will find that the levels are quite low, sometimes alarmingly so. They come up very, very rapidly when capsules of vitamin D. They can be taken on a daily basis, a weekly basis, or a monthly basis. There are different options available, and I would suggest that all individuals should keep a track of their vitamin D levels, and in case they are low, to consult with their physicians so that these vitamin D supplements can be taken into their diet and their values can come up to the optimum level. So, on that note, I'd like to thank you for listening, and I wish you all great knee health and bone health. Bye.